Our Eva is a 13-and-a-half-year-old chocolate delicious lab who was diagnosed in October of 2019 with a nasal tumor. My first thought was, I cannot possibly let down this dog that was so good to me in my time of cancer. And I will do anything to help her as long as it doesn't interfere with her quality of life.
A medical oncologist is your conduit to so many cancer therapies, right? A patient would come in to see us to learn about the biologic behavior of cancer, who it affects, perhaps why your dog or cat got that type of cancer, and then the different things that we can do about it. It might mean surgery, it might mean chemotherapy, it might mean radiation therapy, or it might be a combination of all those things. And the medical oncologist will help you to sort through that. And then they'll also help to guide you to the radiation oncologist or the surgeon.
She had nosebleeds coming out of one side of her nostril, and on CT scan they found a space occupying mass that was pretty obviously of a soft tissue density. And at that time, that obviously instigated a biopsy, and the biopsy came back with a diagnosis of Nasal Chondrosarcoma.
I wanted to try the treatment, and I was pretty positive through the whole thing. My husband and I brought Eva to PetCure Oncology. We were immediately at ease, and we recognized quickly that we were dealing with both competence and compassion.
For Eva, that was recommended probably for a multitude of reasons. One, her age. Chondrosarcoma does tend to be a nasal tumor of adult or even senior dogs. So the anesthetic burden would be a lot less for her in that setting. She, again, would have 3 treatments on 3 consecutive days. So only 3 anesthetic events to get through the radiation itself. We've been doing stereotactic for nasal cancer long enough to know that the survival times that we're seeing are better than, are equivalent to, if not better than, what we could accomplish old school. And then the final piece is that patient comfort thing. The side effects are so much less.
What it comes to is that, when you play basketball or baseball or any sport, every person has a position they play. So in terms of cancer treatments, there's a lot of doctors that are involved, such as surgical oncologists, radiation oncologists, medical oncologists, radiation therapists, and all. And we all have separate roles we play, but as a team, we're able to make cancer treatments a lot easier for patients and also be able to figure out a plan that would best fit that patient as well.
I'm so grateful to PetCure Oncology for being there for her. And she is beyond the perfect candidate because she got up every day with joy, hopped in the car, a little irritated by the empty stomach, but willing to, trust me. Got to PetCure, was greeted with love, took a little nap, woke up a little better.
I have absolutely loved working with PetCure for many different reasons. The first is I truly believe in their philosophy, right? They want to always be on the forefront, trying to do the best radiation that they can for all the animals involved. And it's still an early science, so it's important to have studies, to learn, and to make improvements. And they are 100% on board with doing this.
Stereotactic radiation really has become our standard of care. The way I practiced radiation therapy, the first 30 years of my career are different than the way I've practiced them the last 7 or 8 years. One of the major hallmarks of treating with stereotactic is because we're so precisely targeting the tumor, there's a lot less chance of getting really significant side effects. The time, the cost, the side effects and the number of anesthetic events are almost always the deciding factors for families.
When we do treat our patients, we always recommend coming in usually 3 to 6 months after treatment to do a follow-up CT to see how the patient is doing, to make sure there's nothing else going on or anything of that nature. Carol was wonderful about that. Every 3 to 6 months, she would give us a call to see, can we get a CT done for Eva? Every time we did a CT for Eva, it always came out really nice. It was, we got good results.
It was one of the best days of my life. For my dog, for me, for my husband, it was really magical.
So for Eva to have a chondrosarcoma, which, as I said, can be difficult to get to play along with you, not only have a 50% reduction, but on CT to have 100% reduction in tumor volume, that's a really outstanding outcome. You have a patient that has probably responded better than your expectation or better than the quote unquote average patient would. And the sky is really the limit in those patients. But when you get a patient that exceeds your expectations and that gets back to a normal life and a normal life with their family, that's the whole reason you do what you do. I think the hardest thing for a lot of vets to come to grips with is if they treated a dog for a nasal tumor 10 years ago, and it was a typical dog with a nasal tumor that had all the side effects that they had and that we had to deal with back then, that may have been enough to have them say, boy, I'm never doing that again. So I guess the take-home message is that this is not your dad's radiation therapy.
So I feel like it's this big brain trust that's coming together to treat my patients. And how my patients get treated is very important to me. And it's a reflection on me if I refer someone there as well. But time and time again, they have shown up for the pet parents, for the referring veterinarians, supporting me as a medical oncologist. It is not just about the medicine or the radiation behind all of this.
There are not enough good things to say about PetCure Oncology. First, they saved my dog's life. And even though that was not the expected outcome, it was certainly an amazing bonus. And I was willing to take the 16 to 20 months. I would say to any pet parent out there, take the risk, do it.